Janine on Facebook. Can you spend some time talking about the various healthcare policies in the mix for the 2020 primary? All right, I'll try to start, and you interrupt me if I've fucked something up. So let's start with the public option. And there's various different types of public options, or they're called buy-ins. They've been proposed by a lot of people in Congress. They've been proposed by some of the presidential candidates. Basically, what would happen then is on the exchange, which is the Affordable Care Act exchange, where you'd buy other health insurance plans that are private, there would be one option that would be a government-run plan. And you could buy an insurance plan based off the government plan. You would still pay some sort of premium, some sort of copay, some sort of deductible. It would cover a certain number of services that the government says that it has to cover, much like the Affordable Care Act has to cover now. And that would be that. It would be affordable. It would probably be more affordable than all of the other private insurance plans. And the hope is that because the public option would be more affordable and more efficient, more people would join that public option, and it would force the private insurance plans that are also on the market to be better, to be cheaper, to be more efficient, because they're now competing with a government plan that is pretty cheap and efficient. So that's the idea for a buy-in public option. Then you go up to Medicare for America. Medicare for America, and this was a bill introduced by Jan Schakowsky and Rosa DeLauro in the House. This starts to look a lot more like Medicare for All, but it's not quite there yet. What Medicare for America says is everyone who's currently uninsured in the country would automatically enroll in Medicare. They would be enrolled in a Medicare program. Everyone who is currently buying health insurance on the Affordable Care Act marketplaces, on the exchanges, would automatically be enrolled in Medicare, in a Medicare plan. Every newborn would automatically be enrolled in a Medicare plan. And the reason that is because ultimately this is basically a long transition period into full Medicare and that's why we're having newborns in it. Basically, though, some private insurance would still remain. So if you're an employer, you have a choice. You can either continue with your private insurance plan for your employees, or you can decide, I'm going to enroll the whole company in Medicare as well. So employers have that choice. If you are an employee and you have private insurance with your employer, you can decide either I like my employer's private insurance plan, or I kind of like that Medicare plan that everyone else is getting into. So you can decide as an employee to enroll in Medicare. This Medicare program would cover a whole suite of services. You would still pay some premiums, but it would be a sliding scale. So lower income people would pay nothing, no copays, no deductibles, no out of pocket. And higher income people would pay the highest income people would pay up to 10% of their income in premiums. And I think it's like $5,000 out of pocket, some lower deductible, basically much cheaper than it is now, much more affordable than it is now. And it would be financed, I think, on repealing the Trump tax cuts, something like a 5% income tax on people making $500,000 or more, and a suite of other sort of high-end taxes to pay for it. But it comes with a fully financed plan. So that's Medicare for America. Then you have Medicare for All. In Medicare for All, what happens is the private insurance market is eliminated. There is some private insurance that you can buy for like cosmetic stuff, but that's about it. You can't get your primary care doctor from private insurance. It's all one government plan. Now, one thing people don't often think about is you do get to keep your doctor because every doctor in the country is now under Medicare for All. And so everyone is in the same network. Everyone is under the same plan. There are no premiums, no deductibles, no copayments. Medicare would expand to cover dental, vision, prescription drugs. So Medicare covers everything. So this is like the full suite of everything you've got. The challenge of this plan is the financing because basically Medicare would pay Medicare reimbursement rates to every doctor, every healthcare provider, every hospital in the entire country. And they're used to getting paid a lot more right now from private insurance companies. And so it would be a difficult transition for hospitals, doctors, everyone else to figure out how to adjust to those new rates. and people who put out Medicare for All plans don't necessarily have a financing plan. Bernie Sanders released sort of a suite of possibilities with various tax increases on wealthy people, but most experts look at this and say you're probably going to have to raise taxes even on middle class folks. Now, what Bernie would say is, yes, there might be a tax increase, but you're also not paying healthcare premiums or copays or deductibles anymore. So in the end, it probably washes out.